Hi, welcome back to my channel. My name is Elaine. I am a nurse, a breast cancer warrior, and I am an OFW. Recently, I saw a video of a Filipino lady comparing nurses practicing in the Philippines and in Canada. If I'm not mistaken, it was posted around February or March this year, but it's been taken down since it has gone viral only a few days back, and it has drawn a lot of backlash from the Filipino nurses community. When I saw the post, my initial reaction was, is this a vlog, a documentary, or what? So I decided to watch the entire video, and I found out that it was an ad for a college. As a Filipino nurse who practiced in the Philippines before moving abroad, I would say that the video has a lot of inaccuracies to it, and it doesn't speak for the Filipino nurses as a whole. So I would like to comment about it, but before I do, I would like to remind everybody to please respect and do not attack the person involved. Damage has been done. They took down the video, they apologized, and now let's focus on what they could do to make it better next time. First of all, because the video is an advertisement, I'm not sure whether it was scripted or she picked her own words spontaneously. But I feel it was spontaneous. It was an interview video. But if somebody else wrote that script for her to memorize, didn't she have the chance to consult their team and say, hey, I do not agree on this. Can we revise it? If it was her own words, then perhaps she had spoken out of her own experience. But she could have done it better by doing a bit more research or reflect first before choosing her words. I don't know how long she had practiced in the Philippines before she moved abroad. If it was a long time ago, then most hospital norms, practices, and equipments that were there before may have already changed.
In the Philippines, we rarely speak to our patients, we rarely speak to our colleagues, and more so with doctors. Like, they are so high up there that we do not communicate to them.
I don't know where she worked before and how many nurse-patient ratio were there. Like, how many patients did she use to handle during her shift? But if it was more than 15, it can really be difficult and exhausting to spend more time with your patients. But we do know how to prioritize, and we do communicate with them as much as we can. That's why we have triage, communicating with doctors. What did she mean by not being able to communicate with doctors, like they are so high up there? High up there. I would say it's cultural, but it is a culture that can be changed and has already changed over time. You know, we have this word, hiya, shy. It means you are too timid to speak up because you feel that the person in front of you is higher authority. When I was starting up as a nurse, I did look to the doctors, especially the seasoned ones, with more reverence because I felt that they were higher authorities than they were colleagues. But it has changed already. There are even staff nurses who can speak to doctors like they are equals or they are friends. There are even some who would argue with them, but that's unprofessional. I would say it depends from person to person. Nowadays, thanks to technology, there is a lot of means to communicate with our doctors and even open up your suggestions and care plan for the patients.
I know, we studied assessment skills while we were students. But my question to you, IENs, do you get to practice that? I doubt. Why? Because in the Philippines, we have interns, we have residents, we have doctors, we have students, and so you just look at the chart and they will document their complete assessment of the patient. So we do not complete it at all.
This one really stuck on me. What kind of skills in assessment do you think was she referring to? If she did rely on interns assessment, maybe that's her only. It doesn't speak for all of us. Yes, we do read interns and residents' notes, even consultants' notes to learn about our patient's case, but we do own our assessment. We do not rely on what is written in the patient chart like what she had implied in the video. We are the ones who stay with our patients for a longer period. To whom else would the doctors rely when they are out of the unit if not because of our assessments, which we report to them whenever there are abnormalities?
Because we have a lot of practice scenarios. You can see the laboratory and my back. You get to practice back those skills again. You have to be confident enough okay? So that before you even schedule for that NCAS, you are so confident that you can do it.
I do not know when and where she graduated nursing, but I graduated nursing in 1999, and back then we had nursing arts laboratories, which I am sure have already been upgraded and is comparable to what has been shown in the video. I am curious if she has done any research or observed in any of the nursing colleges in the Philippines in the current setting, but I suggest they come up with a better video without ever comparing the two countries.
Another difference, of course. Now, in the Philippines, we work anywhere. Okay, this time you work in ER, next month you work in another department. Well, it's kind of different in Canada. Why? Because in Canada, you need to specialize in areas.
Her knowledge about this, I think, is outdated. I left in the Philippines in 2012, and back then we already had wound care specialists, transplant coordinators, infection control nurses, hemodialysis nurses, IV therapists, renal nurse specialists. I myself was a PD trainer. I used to train patients and their relatives to do their own peritoneal dialysis at home. Our fields of specialization may not be the same as in Canada, which is a developed country, but it is where we are going. Again, my question is, why compare a developed country to the one that is still developing? Let me know your thoughts. They could have done it better by telling their audience that patient safety is our priority, so we train you to specialize in your chosen field of nursing.
Again, the machines are not the same here in Canada compared in the Philippines. Or maybe we have less machines there. I remember when I was a student, we were using a ruler to measure the CVP. And then when I started working in Middle East, so there's an actual CVP. So imagine those. And I even worked in UAE, wherein everything is disposable, everything is in a kit. In the Philippines, we have to gather everything. Oh, I need this one, I need this one. No, you don't even have to worry about that, because in Canada, we have everything prepared for you. But you have to be familiar and confident in what you do.
I cannot speak about primary, secondary, and provincial hospitals in the Philippines. I have not visited one in the recent years. I have worked before in 2 tertiary hospitals, one in private, one in government, and they are both well equipped with machines comparable to that in developed countries. Yet again, why compare? Why? How did you think these Filipino nurses have become well-rounded? It is because our lack in resources, we managed to find a solution to keep our patients feel safe and comfortable and save their lives. I know a lot of my colleagues who would go beyond their duties and responsibilities just so they can help their patients, and I salute them. I salute them for that.
So, for example, another big difference, you are about to start an IV to your patient, okay? In the Philippines, you don't even explain at all. You just tell them, okay, I need to start IV. That's it. Here in Canada, you cannot do that. You will have to ask for consent.
I do not know why she said that. Is that how she practiced her profession when she was still in the Philippines? Part of every procedure that you do to your patient, even as simple as checking blood pressure, is to explain before you do it. Obtain verbal consent to written procedures and informed consent to major procedures. That is called professionalism. You don't need 1 whole hour to explain each procedure because it's gonna eat a lot of your time. Another thing we need to consider is the staffing ratio. When I worked in the medical surgical ward in the Philippines, one ward had 24-bed capacity and all we had were 2 RNs and a nursing aide. Day shift, we had our head nurse to help. I am not sure if the same scenario still applies today, but I heard from some colleagues in other hospitals, they are handling more. But then again, my question is, how have they come up with an idea of an ad to promote their college by comparing 2 different countries' practices? I don't know with you guys, but I felt that that video is condescending. It is inappropriate, unnecessary, and prejudiced. I suggest that they get a new creative director if they really want an ad that is impactful, accurate, and artistically made. They can try to showcase their nursing lab by creating a scenario. There's a lot of ways to do it. Why compare? Thank you for watching. Please like and hit the subscribe button. And if you have video suggestions, please write it down in the comment section. Bye!